And I've thought a lot about why focus worked for him. And the thing that's difficult to understand about children with autism is that they're overwhelmed with much of the world. It doesn't make sense to them. Information comes in at a dizzying rate. Social information is confusing. People's faces smile and frown and laugh, and people turn away and they come at you and they leave, and they don't know how, children don't know how to process all that, which I think partly explains why they gravitate to facts, because facts are so very reliable. But at Focus, the rules were presented in a very clear, simple way that makes sense both in the program and in the outside world. And all of social interactions can be interpreted using those rules. Be safe, show respect, take responsibility, have a good time. That can apply to all situations, all conflicts, all times to do chores or to help out or to share. They all come down to one of those rules. And so my son could begin to have some fundamental guidelines for what the world expected from him socially and what ways that he could interact with other kids. He had some things that he could kind of rely on. In addition, by having an environment where there are younger and older and more capable and less capable children, all here with adequate staff, there are so many opportunities to practice and practice. And if you make a mistake and it doesn't work, well, you're still recognized for your efforts at practicing, but then you get to repair it. And then you get to try again the next day. And if you make a mistake, you get to repair it. And then you get to try again the next day. Children with autism don't have that many opportunities to have an experience, repair it, and try again. Because in the real world, peers are not that tolerant. They're not that patient. You know, there are other kids they can play with, and so they go off and find someone else. In the worst case, children with autism are bullied or teased. In the most benign of cases, they're just ignored. And so they don't have a chance to practice and practice and try and be told what it is that's not working, not just by a teacher, but by the other child whose feelings have been hurt or whose time with something has been taken away or whose words have been misinterpreted. And so they can hear it from other children and they can give each other that feedback. And they also share many common interests. And so they can feel that they're in a real and authentic social world. They're not in a contrived social world with adults who are always interpreting and saying things and being falsely positive. You know, I think one of the things that my son has learned is he talks too much. And kids at Focus will tell him that. And he's now learned to accept it about himself. He'll say, I know, I get this, I tend to talk too much. At least I've learned, he says, to ask people, am I boring you? Which is a self-awareness on his part that he got not because a clinician or an adult kept saying to him, you can't talk too much, you have to be, but because he got it from other kids who also still like him, and they'll still hang out with him, and they'll still play some games with him. And so he doesn't feel unacceptable, he just feels it's something he's got to work on. I think that by having older children work with younger children, and by having the whole CIT and junior CIT and honorary CIT and intern, children's sense of responsibility and their need to give back and to be leaders and to recognize themselves as competent people is reinforced in a way that can't be done in a classroom, for example, because there's just too much competition for all of the different things that kids want to do. There aren't opportunities to mentor a child who's much less capable. And so children are brought along as with the expectation that they will become responsible, contributing members and not just be the ones that someone has to take care of, which is a huge problem with children with disabilities. We see it in the public schools often, that children lose initiative because they're so accustomed that there's going to be some adult who's going to do something for them. So if they just stand there, someone will come along and tell them what to do, and then they'll tell them the next thing. And so they can just kind of stand around and wait, which is something that children with autism do pretty comfortably anyway, because they have active internal worlds, and so they can kind of amuse themselves for a long time and kind of go off into a self-stimmy state of flapping or finger flicking or any of the other things, pacing, that they do. But they're not really allowed to do that at Focus because you're expected, you're going to mature, you're going to take the next step. And there's so much recognition for the effort, for the intent. And so children want to be recognized for that and are willing to try again, even if their intent falls far short of what you'd really want to happen. They're willing to try again because the primary thing is that the intent was good. And so there's a lot of recognition for that. And then maybe a demonstration of how it could be a little bit better next time. And then a recognition that they intended to do a little better that next time. So that there's always recognition of closer and closer approximations to that mature, independent, person that we want all of them to grow to be, and they all do grow at their own rate. I think it's been the reason that my son is an honor roll student in his high school, that he feels competent in going to school, in negotiating the things he has to negotiate as a student. He expects to do well. He expects that people will recognize his efforts, but he doesn't insist on getting good grades anymore. He doesn't have little temper tantrums anymore because he's learned to accept that there are better and worse times, better and worse results. And he's beginning to see some gray area, which is very exciting. He's beginning to see some gray area. And he's beginning to see that we don't all follow the rules perfectly. And that's not, doesn't make him extremely uncomfortable inside. Somewhat uncomfortable, and he does like to point it out to his dad and me. But he's much more able to say, oh, but that's how it is. We're not all perfect at these things. So I'm very pleased, and I hope that he continues to be able to come to Focus for as long as he needs to.
Hi, my name's Jeffrey Barnes. I'm an intern at Focus, and I've been going here for, I'm 17 years old, and I've been going here since I was 8. And Focus has helped me out a lot. Before sometimes it came to Focus, I would get frustrated really easily. I would easily get frustrated when I would lose at video games and throw a major fit over it. I don't do that anymore, although that did take time, but everything here, but overcoming bad habits always does. I also learned not to monopolize on some conversations. There's a lot, but I'm still working on it, but I've greatly improved on it since I used to talk so much that people wouldn't even get a word in. He first came to Focus because I was having some issues in school and that I needed some help with, and I also needed, and my mom also wanted to find me a summer program that I liked. I had previously tried some kind of summer camp that wasn't right for me at all, because it couldn't handle somebody like me. but focus was what was right for me.